Good afternoon. We'll go ahead and start this afternoon's press conference again with an update on the number of cases of COVID-19 in Iowa. As of yesterday, we have 56 new positive cases for a total of 235 positive cases in Iowa. We had 765 negative cases today for a total of 3,740 negative tests. We have 32 Iowans who are hospitalized as of last evening, and I am sorry to report that we have had 2 additional deaths, and our thoughts and prayers go out to their families at this time. The total number of tests that we have available through the State Hygienic Lab is 970. It was 10 days ago that the first public health emergency declarations I signed went into effect. We continue to monitor and evaluate the impact of the actions we've taken, as well as additional steps that might need to be taken in order to flatten the curve and to slow the spread of COVID-19. From schools to businesses to state government, this pandemic has caused Iowans to rethink how we do things and all of us on how we serve our customers. Iowa courts and judicial system have not been immune from those decisions. They perform such a critical role in ensuring that justice is delivered, protecting the rights of Iowans and performing a range of civil proceedings, and overseeing everything from substance abuse to child custody. And these are not services that can simply be turned off. Today, I'm pleased to have Chief Justice Christensen join us to give an update on the judicial branch's work and operations in light of the COVID-19 crisis. The Chief Justice is joining us remotely from her home, where she is doing her part to mitigate and slow the spread of the virus. And with that, I will turn it over to you, Chief Justice.
Thank you, Governor Reynolds, for allowing me to participate in today's daily update to Iowans. On behalf of Iowa's judicial branch, we too extend our heartfelt thoughts and prayers with the families from Iowa who have been directly affected by COVID-19. We appreciate the sincere dedication of the Governor's Office and the Iowa Department of Public Health to remind all Iowans what can be done to mitigate the spread of COVID-19. The judicial branch joins the governor in her battle cry: wash your hands, frequently cover your mouth when you cough or sneeze, and stay home if you can. I'm following your guidelines, Governor. Welcome to my home. Courthouses in all 99 counties are an integral part of each community. Iowans are used to heading there to renew their driver's license, file a quitclaim deed, show up for jury duty, or maybe even something as simple as paying a parking fine. In less than 2 weeks, the judicial branch has had to combat COVID-19's attempt to cripple how we achieve justice. In spite of these challenges, Iowa's courts are stalwartly committed to making sure essential services remain in place during this crisis. Let me share some examples of what the judicial branch did over a 5-day period to mitigate the spread of this virus in Iowa's busy courthouses and courtrooms. Our first order was entered March 12th and outlined procedures to be followed, such as parties notifying each other if they weren't feeling well, and to consider remote participation in hearings. This next point was particularly noteworthy. A person with something as simple as a runny nose or a cough was no longer allowed to attend in person. A similar order was entered the next day regarding juvenile court. Entering those 2 orders back-to-back was significant. Looking in the rearview mirror, we were only tiptoeing into uncharted territory. For the 3rd day in a row, on March 14th, another supervisory order was entered. This one had more teeth. In a nutshell, we continued all criminal jury trials and grand jury proceedings to at least April 20th. And we continued all civil jury trials to at least May 4th. At that point, non-jury civil trials and hearings were going forward as scheduled. In juvenile cases and problem-solving courts, we encouraged our judges to conduct those hearings remotely. For our appellate courts, we ordered that there would be no in-person oral argument through May 15th. 2 days later, we entered our 4th supervisory order, which lifted the cap on the number of online classes lawyers can take for continuing education. The very next day, March 17th, it became clear that we had quickly moved from tiptoeing to downright stomping into this uncharted territory. I reconvened the same small group of people who gathered only 3 days earlier at the Judicial Branch building. But this time, we were committed to this new thing called social distancing. Thus, our fifth supervisory order was created remotely, and it packed a punch. Here are a few things addressed in that order. All criminal trials, jury and non-jury, were continued. Initial appearances and bond reviews were to be held remotely. And we extended the 45-day speedy indictment deadline to 60 days. In civil cases, all civil trials, jury and non-jury, were continued. Forcible entry and detainer cases were continued or ordered to be held remotely. If something could not be held remotely, the only in-person matters would be emergency proceedings, such as protective orders for domestic abuse or elder abuse, treatment for substance abuse, mental health hospitalization, protective removals of children, or anything else considered an emergency by the court. In spite of these unprecedented measures, I want you to know Iowa's Judicial Branch is open for emergencies and essential cases. Every day, even now, there are judges, clerks, court reporters, court administration, and other branch employees working in new and unique ways to serve Iowans. But we cannot do this alone. Iowa's Department of Human Services has been working closely with us to ensure the safety and welfare of children and to provide their families with the support and assistance they need to maintain vital connections. We're also working with the Department of Corrections and law enforcement services across the state to implement measures to minimize the harm inflicted by COVID-19 on our incarcerated population, as well as the staff who work in those facilities. The County Board of Supervisors across the state has worked with the Judicial Branch to ensure that our courthouses can remain open to the fullest extent possible. For anyone needing an in-person access to our courthouses at the Judicial Branch, please call in advance of your visit. Phone numbers for each county's clerk of court are posted on most courthouse doors, or you can also find it on the Judicial Branch's website, iowacourts.gov. Much of the information I have provided today can be found on our weekly summary, which is posted on the same website in our special section devoted to COVID-19. When COVID-19 started to rear its ugly head in Iowa, I urged our Judicial Branch employees and lawyers to not panic. And I reminded them, we are all in this together. In an effort to provide everyone an opportunity to share their comments or concerns, I invited them to send an email to my senior law clerk, Anna. People took advantage of this, and as a result, we learned a lot. And it has been a useful tool when making critical decisions on behalf of the Judicial Branch. I have nicknamed that idea Ask Anna. You can find a link to Anna's email address on our weekly COVID-19 summary on the Judicial website. In closing, as Chief Justice of the Iowa Supreme Court, I am constantly monitoring these changing events. The Judicial Branch will keep all Iowans informed on our website as significant decisions are made. Once again, that's iowacourts.gov. Please pay particular attention to a special section devoted to COVID-19. Access to justice may look a little different right now, and it may require a bit more patience, but it will not succumb to COVID-19. Thank you again, Governor, for this opportunity to provide Iowans with information about the Judicial Branch's response to this pandemic. We appreciate the opportunity to maintain communications with your office and Iowans on these very important issues.
Thank you, Chief Justice. And I also want to just say thank you to you and the judicial system for all that you're doing to make sure that we can ensure access to justice during these times. Also today, I have asked the Department of Education Director Ann Lebo to provide an update on the work being done between the state, public school districts, and independent schools to ensure that Iowa's K-12 students continue to have opportunities to learn. And with that, Ann?
Thank you, Governor Reynolds. We all know how important it is for Iowa students to continue to learn during the COVID-19 emergency, which is why the Iowa Department of Education has been working tirelessly to support schools, community colleges, and families. Since I stepped into this role 2 weeks ago, the department has issued guidance nearly every day on such topics as standardized testing, high school graduation, conducting school board meetings, and paying teachers while schools remain closed. We've also helped schools mobilize grab-and-go meals for students, stand up emergency child care centers, find creative ways to connect with students, and build an online bank of resources for families as they manage day-to-day life without school. Even though schools are not required to offer learning opportunities while they are closed, they are certainly able and encouraged to do so as they consider the needs of the families and the learners they serve. Clear Lake schools, for example, have been able to provide access to students through their one-to-one program, which provides one device for every student, and by partnering with a local provider for students to have access to Wi-Fi, and delivering an interactive video board to the home of a student with additional needs. Rock Valley Community School District is offering optional learning opportunities for all kids, including students with special needs. Kindergartners have paper packets, and the district made sure each 1st through 12th grader has a device. All teachers also are checking in with their students at least once a week to make sure they feel connected to school. Innovation at this time of uncertainty is important. And the role of the Department of Education is to ensure we maintain a minimum standard of care while allowing the maximum opportunity for growth through flexibility at the local level. To further that capacity, we convened a task force to look at what we can do better and more consistently statewide for the variety of communities and learners we serve, regardless of how circumstances might change going forward. Wednesday, I brought together a continuous learning task force with 31 representatives from school districts, non-public schools, Iowa's 3 virtual schools, AEAs, and statewide education associations, among others. The purpose was to discuss pathways for providing Iowa schools with immediate, scalable options for online and distance learning during this emergency. The consensus from this group is that it's important to grant local districts and schools flexibility to meet students' needs, and that it takes time to ramp up, which will be captured in the guidance we are sending out to schools later today. Our team at the Iowa Department of Education is committed to supporting our schools and will continue to work tirelessly to ensure that we are all better as a result of the challenges we are facing today. Thank you.
I want to thank Ann and her team and schools all across the state for reimagining education for Iowa students during this unprecedented time. Your work is so important, and it's very much appreciated. As we end the week, I think it's important to acknowledge that even during these uncertain times, Iowans can still count on each other, and the stories of individuals and families and businesses stepping up to help each other are truly inspiring. And I want to share just a couple with you today. NSK in Clarinda is making bearings that Ford Motor Company is using to retool parts of its F-150 truck line to create much-needed respirators for the healthcare industry at this critical time. At DOT way stations across the state, the Iowa Motor Truck Association and Iowa restaurants are providing free lunches for truck drivers who remain hard at work, keeping our economy moving and ensuring our grocery stores are stocked and getting critical medical supplies delivered to where they need them the most. And finally, to support local restaurants and its communities, Premier is picking up the tab for its employees once a week when they order carryout, drive-through, or delivery for lunch in their local service territory. So Iowans, they have a can-do spirit that will make a difference during these very challenging times, and that is such a small sampling of the stories that we're receiving daily of what Iowans and businesses and families are doing across this state in these really uncertain times. So thank you for continuing to do your part, and we're going to continue to do ours. And as I've said every day, we're going to remain calm. We're going to do what we're supposed to do. We're going to get through this, and we're going to hopefully get things back to normal as soon as we can. And with that, we will open it up for questions.
Governor, the FDA is releasing guidance saying that negative tests don't necessarily exclude the possibility of COVID-19, and perhaps there should be some guidance after they get that negative test result. So what is the protocol for people who get negative tests? Are they told that they ought to still stay home and monitor symptoms? What does that look like?
Thank you. So this is one of the reasons exactly why we have been saying for weeks now that if you're mildly ill, you need to stay home. Even if you have a negative test today, it doesn't mean that you can circulate within the community and you would have a negative test 4 days from now. And so to any Iowan that's feeling ill, even if you're feeling mildly ill and you receive a negative test for COVID-19, we would ask that you stay home until your symptoms resolve.
Governor, I know yesterday you were asked about the letter from the president to governors that came yesterday, and you said you hadn't had time to look at it. So I'm hoping to ask you about that again, and wondering if you think it makes sense at this time to make decisions based on county by county, like rate counties and make decisions based on individual counties when people can still move throughout the state.
Yeah, so I think, all of the decisions that I've made throughout this whole process has been made with the data that we've received. When we went to substantial spread, then we made the decision to encourage schools to close down, to shut down businesses. We've limited the number of people for social gatherings. When we talk about putting in place metrics for shelter in place, we put together criteria that we're using to make some of those decisions. And we're able to do that not only statewide, but regionally and by community. So as we look for different policies and procedures that we're putting in place, I think this is Dr. Badati's verbiage, so I'm kind of stealing what she's been saying. We are also taking into account how we maybe dial things up if we feel that there's areas that we maybe need to do more, and how do we dial things back. So as we talk about bringing back online some of the businesses that we've closed, this is some of the things that we can potentially look at. March 17th was when we went to substantial spread and we started some of the policies that we put in place. So we're actually not even through that 2-week phase at this time. So we anticipated the numbers, as we're testing more, the numbers of positive cases to continue to rise. We think we'll probably see that through next week as well, and hopefully once we get to the 31st, or kind of the timeline where we've implemented some of the policies, we'll start to see that hopefully flatten and eventually maybe tick down. Now, another factor that we'll be watching next week also is we've had people return from spring break, and we encouraged very strongly for individuals that traveled outside of the state to self-isolate for 14 days so that, again, we can protect vulnerable Iowans, help to mitigate and slow the spread, and eventually pull out of this quicker. So we're looking at that data all the time. We're looking at it when we're working with our hospitals and we're talking about surge and what are our plans to deal with that. We're looking at it when we bring on additional healthcare declarations. What do we need to adjust to maybe, again, help people stay home? What decisions will we look at when we start to open businesses back up? And I think what the president is trying to say is just we're different here in Iowa than they are in New York. And while we get on the phone with all the governors across the state and we can walk through some of the data points that they've seen and that they've used in making the recommendations that they're making, we still have to take into account the factors that exist within our state. We don't have a big mass transit system. We don't have the dense population that New York has. So there's just all of those factors also are a part of the decisions that we're making. And I've told businesses that we've closed, we're evaluating all the time. Believe me, I want to get things back to normal as soon as we can. And so, but we have to be responsible, and I have to balance that with making sure that we're taking into account the health and safety of all Iowans, and especially some of our most vulnerable.
I guess, though, with the lack of widespread testing, would it make sense to rate counties like low, medium, and high risk at this time in the state of Iowa? Do you think?
Well, that's not my priority right now. We'll look at that, but we're taking, because we're still not even through the 2 weeks, we're still anticipating our cases to go up. I'd like to see them somewhat flatten before we take the next step. Sarah, do you have anything to add to that?
What I would say is, very much as we're looking at the metrics that the governor has outlined that we've been talking about this week, that's essentially kind of what we're doing. Exactly. And in part of that analysis is we are identifying as case counts change in counties, as we expected that they would, and we're looking at the rate of hospitalizations of those cases and the population of that county, are they majority over the age of 65? The metrics that we put in place kind of account for some of those things, and so those are the counties when we're thinking about, are there additional mitigation strategies that we need to consider? We've kind of already done that in a way.
Yeah, and that's my point. I don't think we're ready to label yet. So we are doing that in a sense, especially, hopefully that will help us identify if there's maybe a hot spot that we really need to focus on. It also helps us when we're making decisions about getting PPE where it needs to go. All of those metrics are factored into that as well.
Governor, understanding that the metrics don't indicate that there should be the shelter-in-place order yet, nonetheless, a Des Moines area doctor started a petition today stating, quote, substantial lack of testing, PPE, and critical care capacity means that the state should be in shelter-in-place. Do you have a response to that?
Well, all of the policies that we put in place have been done to do exactly that, and that's to make sure that we're taking every possible action to preserve PPE. We're an all hands on deck to make sure that we're doing everything we can to meet the resources and the needs of our healthcare providers as well as our first responders. We know that it's so important as they are standing on the front line to make sure that we're protecting them as they're taking care of Iowans. So here's what we balance, and this is why it's so important for me to make my decisions based on data. I also have hospitals that have sent letters to me saying, please don't issue a shelter in place because it would only exacerbate what we're trying to do. It starts to spread, to spread fear. It impacts the supply chain when we're trying to get the critical PPEs across the state. All of that factors in. So we have people on both sides of the issue, and we have offered resources and our team to sit down with our hospitals and with our local public health officials and our elected officials to walk through the data points that we're using to make the decisions that we're making. We've said we're open if you've got other metrics, that you're looking at that might factor into what we're doing. I would love to see that. But and the other thing I would ask is, what else would they have us do that we're not already doing? Because again, I'll go back to the example in some of the other states. When they issue a shelter in place, and by the time they account for all of their essential workforce, they've excluded almost 80% of the workforce in their state, and that's the state of Minnesota, that doesn't qualify for the shelter in place. So I believe Iowans don't need an order to do the right thing. I believe they know what they need to do. And again, if they follow through, stay home when they're sick, practice proper hygiene, only go out when you need to, check on those loved ones that are vulnerable to make sure that they have the supplies that they need, we will get through this sooner rather than later.
If you say what you're doing is equivalent to a shelter in place already, why not just call a spade a spade?
I am not, because it doesn't happen. It's not consistent across the state, and there's no reason for me to do that. We have taken measures all along that we have based on the data that the Department of Public Health has provided to me, along with and working in coordination with the CDC as well as with other factors and surrounding states, and they're bringing all that together and providing me with the information and the data that I've made decisions on. And so I'm going to continue to operate in that manner so that I'm not just reacting, so that I'm not, you've got Governor Cuomo that's saying today or yesterday that maybe I shouldn't have done a shelter in place. So here we go. It is bouncing back and forth, and when you react and you don't base your decisions on data, then you are bouncing back and forth, and that drives fear. You've got to also look at the mental health of Iowans when we're asking them to not go anywhere. So we're trying to be responsible and practical. I want to be consistent in what I'm telling Iowans, and the way that you do that is you base it on data, and that's what we're trying to do. And Caroline, to your point, I have said, at this point, we're not going to shut down schools. The next day, we moved into substantial spread. Based on the data, I had to make the decision to recommend shutting down schools. The same thing with businesses. So even though it varies, and because there is a hot spot in one area of the state, it might not be practical for me to issue a statewide stay-at-home when at this point the data is not driving me to do that.
Clark Hoffman at the Capital Dispatch. Thank you, Governor. You've mentioned that there have been numerous and ongoing discussions about the need to expand Iowa's hospital capacity. Can you detail what actions specifically you've taken or your office has taken as a result of those discussions?
Yeah, so our team has met almost on a daily basis. They're working within the healthcare coalitions across the state that actually have been in place, I think, since 9/11. So am I close to that? We're close. Anyway, they are working within the healthcare coalition, so there's been ongoing discussions on, how we identify a potential surge, number of beds, how do we work within the regions and the resources, and how do we do everything we can to mitigate and slow the spread and really help prevent overwhelming our hospital system. So I met yesterday with all of the, so those have already been going on. And then I met yesterday with the CEOs of most of the major hospital systems to ask them to work within their regions, to come back to me by next week, next Thursday, I think is when I asked them to provide me the data on what their plans are to deal with not only hospital surge, but from within their existing hospital, but how we address it from a regional perspective so that we can make sure if one hospital is at capacity, what are the follow-up actions or what other availability do they have to make sure that we can continue to meet the needs of Iowans. So they're gonna get together, put a plan in place for worst case scenario. So hopefully that doesn't happen, but in the case that it does, we'll have a plan in place and ready to go, and we'll do this in regions throughout the state. So we're going to start with some of the larger regions, and then we'll be able to extrapolate out from that.
Rachel Drozzi at Channel 5.
Hi, Governor. Two questions. One, viewers have reached out and asked if the state will be helping essential workers get access to masks and gloves. I know a lot of the main focus is for hospital and healthcare workers on the front lines, but there are many other essential workers and industries that are concerned that they're at risk. And then another question, this one may be for IDPH, but could you explain more about tracing COVID positive people? Who is responsible for telling that person they're positive? How extensive is the tracing? And how many health detectives and investigators are working on that tracing?
So I can tell you we are working through our, I would say, local public health officials with the PPE and making sure that we're providing the protective equipment for all essential workforce. We're also working, we've got different variations of mask that we're working on, so we've got a real concentrated effort right now on face shields, because if we're able to make the face shields not only through the ordering, but to start making our own here in the state of Iowa, then we can be a little bit more flexible with the face mask, so it doesn't have to be the N95, so that gives us a little more flexibility there. So as we work through what some of the shortages are and what we can do to account for that, we are doing that again on a all hands on deck from every resource that we can. But I believe it is we are accounting for the essential workers in the orders that we're taking as well. Do you want to? I'm not for sure if I can remember what that.
Yeah, so the process would be locally, if there are needs for personal protective equipment that can't be filled through the existing supply chain that people usually use, those requests need to go to the county emergency management office, and those local emergency managers will submit that request for resources into the state web EOC, and those requests, once they're received, they're prioritized, and those are the missions the National Guard has been doing this week, taking that PPE out to the counties. So we'll continue to do that as long as the state has PPE supplies, but it is true that there's a PPE shortage in the country, and so that's another reason why if people are really mildly ill, they really need to stay home, because every encounter that they have in a healthcare facility, we're using PPE to take care of those patients, and so we are doing everything we can to also preserve the PPE supply that we do have.
And what was the question on tracing?
Yeah, sorry, Rachel. And so, yes, related to contact tracing, due to as the number of cases in our state have increased, the local disease investigation work has moved to the local county health departments. And so we have 99 of those throughout the state. And so each county locally is working on those confirmed cases. As Governor Reynolds said, the provider does provide that information to the patient, but then local public health agencies follow up immediately to do that contact tracing and notification of anybody that they believe is necessary to be notified that they've had exposure to a confirmed case.
Dave Price, next question.
Good afternoon, Governor. You're getting all the questions about shelter in place. I'd like to go the other way, though. We're hearing from people who have the total opposite opinion of this. You've got Rush Limbaugh out there saying that health experts are part of the deep state. You've got people pointing out that seasonal flu kills a lot more people. The president's pointed out car crashes kill a lot more people. You've got people making videos where they're licking doorknobs and rails and all that stuff. What do you say to those who say that you don't frankly have the authority to shut down places like you have, and that this is all frankly an overreaction to something that will pass?
Well, first of all, it's not an easy decision for me to make. It is the last thing that I want to do. The last thing that I want to do is impact families and individuals and our businesses that are the backbone of our economy. So as the governor of this state, I can assure you that the last thing that I want to issue is an order that shuts down a business and puts families and individuals and as I said, the backbone of our economy at risk. And so I don't take them lightly. This has been some of the hardest decisions that I have had to make as the governor of this great state, but it's also a necessity. I have to do what I can to protect the well-being of Iowans, and especially our most vulnerable Iowans. And that's, again, the reason that I'm trying to be very consistent in what I'm doing and basing those decisions on data. And hopefully by doing that, I can get businesses stood back up and we can get this economy going again. I understand that the CARES Act was just passed through the House in Washington, D.C., so we'll take a look at that, and hopefully we can continue to provide the support and some resources to get Iowans and families and businesses through these really tough times, and hopefully get them stood back up so that we can, again, have one of the lowest unemployment rates in the country, and we can have one of the highest workforce production rates, and we can continue to keep our communities vibrant and growing. So I appreciate, I know that's out there, and I know, Iowans are scared and they're nervous, and I appreciate that, but we're going to get through it. And if you keep doing what we've asked you to do, we will be back to those good days. So hang in there.
Rod, next question.
Yes, Governor. Iowa moved into a new phase this week with the 3 deaths that have been associated with COVID-19, and little's known about the circumstances surrounding those deaths. All the victims so far have been elderly or in the high-risk cohort, and Iowa has a large elderly population. So that being the case, can we expect the number of fatalities to ramp up based on what you're seeing in the field, like is happening in other parts of the country? And do any of these deaths point to any problems associated with challenges facing our healthcare system? Also, is there more that can be said generally about the circumstances surrounding these deaths, if they involved hospitalization, access to ventilation, or ventilators, or anything else within the bounds of what can be shared with the public?
So I've asked for that report in the morning, the number that are on vents and the number of underlying conditions. I don't know. I'm going to have Sarah address some of that, but she's going to say, too, I think, if I know Sarah, again, the more things that we can do up front, it goes a long way in protecting our most vulnerable Iowans. And so we as Iowans have a responsibility to do our part to make sure that we can mitigate the number of deaths that we see in the state of Iowa. Our hospitalization numbers right now are 32, and a lot of those were already in the hospital, which is a priority to test, and so they're being monitored. But I'll let Sarah address some of the other questions that you had.
Yeah, thank you, Rod. So all three of our patients who have unfortunately passed away from COVID-19, they all are, two of them are older adults, and one of them is in the elderly category. And I know at least one of them had underlying health conditions. And so from everything that we do know about the virus, this population of individuals is the population of individuals that are most hardly hit when they do acquire the disease. And so, again, to the point that Governor Reynolds just made, that's why it is so important for the rest of us who might not meet those particular criteria of being an older adult or somebody that has an underlying health condition. That's why it's just critically important that if we are ill, that we stay home as much as possible to avoid exposing our vulnerable Iowans to this disease.
Last question is going to Chris Goffner, KCCI.
Hey there. So with so many people either unable to be tested or waiting a week or more for results, is there a metric, a model that estimates how many people in Iowa actually have this versus how many folks have tested positive?
Thanks, Chris. We are working. We've heard requests for information about, kind of more of the testing landscape and how many people are being tested and who's being tested and where are they. Is it just that, nobody in a particular county is receiving a test information? And so we're working on a way to make that information more publicly available. I can tell you that people throughout the state are currently being tested. We haven't seen positive cases in all of our counties yet, but we understand that there is a desire for more information about how many people are being tested and where people are being tested. It is happening throughout the state, and we do continue to expect testing capabilities to expand as we move forward.
Thank you. Be safe.
Thanks, everyone.